right. Today I'm with Dr. Sean Dineen from the CGSO Program Directors Working Group. He is the chair, and we're going to talk a little bit about the match and some of the activities that they have planned for this year for the Surgical Oncology Fellows. So welcome. And my first question is, can you just point out to everyone, we made some changes. The working group is new, and we still have the full committee of program directors. Could you go through that a little bit?
Yes, great. Thanks for having me. So we noticed that as the number of surgical oncology programs continued to increase, the full program directors committee was starting to develop a large number of members, and so we identified the need for a smaller working group, and so we've set up the program directors working group, which consists of 10 program directors plus myself and Dr. Russell, who's the co-chair. And that smaller working group now is a little bit more flexible, and we've been able to assign projects to members of that working group to really focus on. And we've made sure that the working group represents both diverse geographic locations as well as smaller and larger programs.
Yeah, that's great. And the ultimate goal is to allow lots of different program directors to rotate through the committee over the next few years.
That's right.
So next question, how did the match process go last month?
I think the match went well, and to my knowledge, talking to many program directors, it's been successful. I think it was a new time for a lot of us as we went back to in-person interviews. We're collecting some more specific data, but it looks like about 75 to 80% of programs went back to in-person interviews. And so that was new for this year. And I think everyone that has reported so far has been pleased with their match, whether it was in person or virtual.
Mm-hmm. And how many programs are there right now? And how has that looked over the last few years?
So the number of programs, as mentioned, is increasing. I think there are now 41 total programs. I believe 39 or 40 participated in this year's match. There was 105 applicants that submitted a rank list this year. And this year was competitive, and I think the trend has been that it's more competitive. So 76 residents matched this year.
Mm-hmm. Right. Okay, and tell me about what your committee's doing for educational activities this next coming year.
Yeah, thanks. We have what we think are a lot of great educational opportunities. The SSO Fellows video conferences run through our committee, and we're excited about the lineup this year. So we have every other month, generally, a video conference. We have retroperitoneal sarcoma in October. In December, we do a career discussion. So we switch the focus to more professional development. And Dr. DeMatteo, I think you're going to join us for that one. So we're excited for that. Mm-hmm. February is melanoma, April is breast, and then June is thyroid or in endocrine. And that curriculum is built on kind of a 2-year curriculum. So as we move into the following academic year, we'll see more sort of GI topics come into play. We also have the Fellows Institute in November, which we're very excited about. That'll be at the Mighty Center in Houston, and is a 2-day course with didactic and lectures on the first day, and then a cadaver lab the second day. And it was great last year, and we're anticipating that it'll be really educational again this year.
I remember these video educational conferences for years, started long ago by past President David Bartlett, and it's a great continuation. It's fascinating to take part in those, and I think it's a very strong part of the fellows' education. So, well, thanks very much for joining us today. Keep up the great work. It's one of the more important committees within the SSO.
Thank you so much for your time.